It's Dr. Ellie with Middle Path Integrative Pediatrics, and I am here today with my friend and also majorly wonderful, amazing yoga teacher and doula, Paulina. And Paulina, can you pronounce your last name for us?
Yeah, my last name is Schau.
Perfect. And do you mind telling us today who you help?
Yeah, so I am a certified full spectrum doula and I help to support families.
Okay, wonderful. And I'm so thankful for you being here today and taking the time.
Absolutely. Thank you.
So I was hoping to ask you, what inspired you to become a doula? What inspired you to teach prenatal yoga? And how has your personal journey shaped the way that you support expecting parents?
Absolutely. Yeah, that's a really good question and one that doulas love to talk about. But for me, it definitely stemmed through becoming more involved in reproductive justice advocacy and just understanding, just more around families' right to choose overall, which also includes how they want to birth their babies, how do they want to raise their children, and following that path of advocacy led me to also discovering birth doula support. And I just thought it was the coolest thing ever of folks getting to see their themselves in their rawest form and how can we support and facilitate that in a way that is holding true to what they're hoping to experience and have. And in terms of prenatal yoga teaching, yoga has been important to me for so long in my life. I've been a practitioner for well over a decade, and after finding myself in birth doula work for a while, I had the opportunity to train with Flow of Life yoga as a perinatal yoga teacher, and it was just a seamless fit. So it's helping folks move their bodies in ways that feel good and accessible for them, and giving them a little bit of time to drop into their bodies. And how does this feel for me? Does this feel right? Does this not feel so good? And again, there's that choice and advocacy there, as well as just creating a comfortable, cozy environment for folks to be around other perinatal people. And that community aspect is really beautiful to me too.
Yeah, I love that. I think we had talked in a different conversation about how you are a healer and how you use the somatic experience in both yoga and in your doula work. And I really love that. And for those who are not familiar, can you explain the role of a doula and how does it differ from a midwife or an OB? Because
Yeah,
sometimes it's like, what is that difference?
totally. It's a good question. So, a doula is a professional companion that works with folks through various reproductive health events. So, that can include pregnancy, postpartum, fertility, adoption, abortion. There are folks that are trained in all of those realms, which I am, and that's called a full spectrum doula. Or some folks just specialize in parts of that. And so I've found through my practice that birth doula support is what really makes me light up, and how it differs in what a midwife or an OB does is we are not medical professionals, so we cannot diagnose, we cannot treat. Yeah, an OB or a midwife, again, has those abilities, and they can also help to birth your baby with you. And so, as doulas, we are not there to catch babies, as some folks say. We're just there to stand alongside you. On occasion, sometimes a doula accidentally catches the baby. If the doctor is not in the room or a nurse or whatnot, babies come when they want. But traditionally, we're there to accompany you through that process.
Yeah, so it sounds like offering a lot of emotional and physical support to the birthing parent. Can you tell us a little bit about some of those things that you do during the birth that's helpful or even beforehand?
Absolutely. So doulas also provide mental, physical, informational support, as well as advocacy support in the birth space as well. And yeah, that can show up in a lot of different ways. So whether that is like informational support, especially during pregnancy, so helping families figure out what do I need to know? Because there's so much information out there. There's so many books, there's so many classes. And how do you kind of sort through all of that and kind of summarize that in a way that's accessible? Of like, okay, do I really need to know? Or I just got back from an appointment with my OB or my midwife and I still have these questions, or they said this, but the appointment was so fast. What does that mean? And so we're kind of really that gap in care that's there to process afterwards. And we can help point folks towards directions of evidence based information and support that they can read up and again, kind of do more research on.
Yeah, I think that's really important to have. I think, as a medical professional myself, I mean, I have the luxury to take more time with my patients because that's the way I set up my practice.
Right.
But many medical professions are in systems that are challenging in that way.
Mm-hmm.
And they may not actually have the time to spend to sort of talk through things
Mm-hmm.
with the birthing parent. And I think I've noticed, especially like around birth plans and things like that, it's sort of like, well, here's all the options. And then you don't have necessarily the time to like marinate in it or meditate on it or,
Yeah.
whatever your tradition may be.
Mm-hmm.
And so just to have even like a sounding board to talk about, like, what are the birthing positions and like, what is a water bath and like,
Yeah.
do I need to consider X, Y, and Z to bring to the hospital or, the birthing center or whatever it may be.
Mm-hmm.
And just having a person to like run those ideas by can be super supportive.
Absolutely, absolutely. Yeah. And again, someone who has seen it too. So it's like, again, here's these birth lists that you find online of what to pack. And it's like, okay, but what do I really need? Or what's missing from that list? And it's someone with that experience that can help with that as well.
Yeah. Yeah. Well, I hope you don't mind. I'm just going to hop back to prenatal yoga. I probably should have split this pod into two now that I'm thinking about it.
There's a lot to talk about.
Yes, there's so much to talk about, and maybe we'll have you back on if you don't mind. But just kind of briefly, because I think prenatal yoga is so beneficial, because oftentimes I notice birthing parents sort of get stuck on the birth, which
Yeah.
is understandable because, like, huge, right? The birth, especially if it's your first. And I notice not that people aren't aware of what to do prenatally, but sometimes people don't think about that journey. And so, what are the unique benefits of doing prenatal yoga for physical and emotional well being during pregnancy?
Yeah, absolutely. I think it's a time to slow down. Again, it can be such an overwhelming time of wanting to do the right things, or again, just kind of this focus on the birth itself. And in prenatal yoga, it's kind of that bringing that focus back to what's happening in this present moment. How does my body feel right now? Where am I holding tension? Does that seem to be a pattern? And kind of learning, again, just more about your body and how it's changing during pregnancy. And I also think a really important aspect of it is the community piece. So there is something so healing for folks about just being in a room with other pregnant or postpartum people and just being like, oh, you also have heartburn? Like in a class the other day, like everybody there was talking about how they all had heartburn and different things that they were trying. And it's just like, oh, I have that too. And there's something, again, just so important about having that community and knowing that you're not the only person experiencing this. And I think that's, again, that community aspect is so helpful in so many different ways.
Yeah, I agree. I think being in a community of like minded people, or even people that have differences, but maybe on the same journey or having
Mm-hmm.
a different journey, it's just nice to be able to chat.
Yeah.
And I feel like that in my practice too, like being in a community where you can feel like your values are aligned with the person that you're seeing, or, at some of the events we can meet each other and all of that. I think it's so
Absolutely.
important.
Mm-hmm.
And then also just the benefits of like stress reduction and like pain in the body and all of those too.
Yes, definitely helps with sometimes alleviating some of those common pregnancy discomforts that you hear a lot about, whether that's low back pain or sometimes pelvic pain in different areas. Some of the movements and stretches that we can do to target that and also help us to become more familiar with our pelvic floor and how can we relax that, and breathing techniques and how that can translate to the birth space. There's so many pieces that can be helpful both in pregnancy, during the birth itself, and then also through postpartum.
Yeah, and that's actually a really good point because I was going to ask you that, how does the mind body connection play a role in labor and delivery? And it sounds like there's a lot of connection. Do you want to elaborate a little bit more on that?
Yeah, there's so much. It plays such a part. So again, it's just this awareness in our bodies, and I think that our society is so busy these days, and we have to be because there's so much always to do. But it's really figuring out, do I tend to hold tension on one side of my body more than the other? And how could that affect baby's positioning that they're in the pelvis? And how can that positioning affect the birth process? And there's also, if we're feeling a lot of anxiety, if there's a lot of unknown about what's happening during the birth process, that can relate in tension. When we're scared, we tense up. And same with the pelvic floor. The pelvic floor is like, nope, like this isn't safe. Like, no, we're not going to have our baby here. So attending to and understanding what somebody's triggers are, or what, is that, do they have a history of medical trauma or other trauma that's happened through their life that could be triggered or come up in that birth space, and how can we bring somebody back into their body? Does that mean getting all of the people out of the room, so it's just the doula, and if there's a birthing partner there, to kind of tune in and help somebody come back in and feel present, and or if it's releasing the tension, again, there's different movements we can do or different positions to try to help facilitate the movement and spaciousness that the baby needs to keep on moving down in the pelvis.
Yeah, I think that's a really good point. I actually had a patient's mom. I'm a pediatrician, so it was a mom
Yeah.
who she was explaining to me, she was just like feeling really stressed by the OB, and sort of like there was just like a lot of pressure and tension in the room. And really, all of those people had to leave.
Oh, right.
Yeah, literally 3 minutes later, the baby was born. I believe, I don't fact check me on this, but I believe it was just with her doula and midwife, and that was kind of
Yeah.
it. She was like, I just couldn't relax enough to just let this happen. And so,
Yeah.
yeah, I think sometimes that medicalization, while in some cases can be life-saving, in other cases can be, and to your point, when you're creating stress in a stressful environment, it could be a detriment as well. So
Yeah. And sometimes too, it can be just like, even as the doula, I'm like, if you and the partner just need time together to, get some cuddle time in, get some oxytocin flowing, like, it's not going to offend me if you ask me to leave too. Like, I will volunteer myself to leave. So again, y'all can connect in that way. But yeah, there's so many different ways to help facilitate that mind body
yeah, that's
connection.
really important, is having people around you who you do feel comfortable using your voice around. And I think, someone like yourself who's just so kind and
Mhm.
loving, and just your energy is amazing. I haven't been in a birthing room with you, but I just imagine that that is so comforting and calming, and um, what's the word that I'm looking for? Supportive of the birth process. And
Mhm.
to work with someone like you that you can literally say, love ya, and I need 10 minutes
Yes.
is so important. And the same goes, I think, with medical providers too. If you
Mhm.
you just feel like this person is not listening to me, may not be a good fit. So that's
Yeah.
an important point of like interviewing doulas, is like, do you literally feel comfortable just using your voice and talking?
Mhm.
Sometimes I think that can be an issue. Okay. So we touched on this before, and I maybe can say more about nutrition as well, but
Yeah.
yoga, mindfulness, holistic approaches in general, just kind of like, what have you seen just in your work as far as improving pregnancy outcomes? Have you noticed, I know you're not a medical professional, but just have you noticed in working with so many birthing parents that you've seen better outcomes?
Definitely. I think that, and again, I think that it's whatever is most accessible to somebody and what they can actually understand and want to follow is going to be what's most important. So, whether that is a focus on food, if they're really passionate about, focused on a diet that is supportive of themselves and a growing baby, or whether they feel really connected to acupuncture or massage. Like every modality will have different benefits, but it's also not realistic that we can access all of these things at the same time. So it's like whatever, again, that we are able to do, each of these things will have benefits. And same with prenatal yoga. It's like, yeah, if you can find yourself in a class, there will be benefits. And yeah, it's just, again, whatever modality that you choose will have benefits, but it's whatever you are able to connect with. And yeah, again, kind of what feels right for you.
Yeah, like 100%. Because I notice sometimes that, and I have done this too, I'm completely guilty. My de-stress plan is now like making me stressed out because it's
Right.
like, I've got to eat perfectly and I better get all of this exercise and drink the water and let me write it down in my app because I'm a little neurotic like that.
Right.
Get to yoga. And then, like, by the end of the day, it's like, it's too much.
Yeah.
And take the supplements. And it's like, okay, well, how can we dial in the parts that are actually helping you and me, rather than focusing on all of the things. But I do agree, like nutrition, like if you can, like at least your prenatal, your
Yes.
folate, your omega, maybe a probiotic, those
Mm-hmm.
kinds of things are really helpful. But
Yeah.
mostly let's just try and focus on those basics, sleep and eating your veggies, if nothing. If nothing.
And sometimes your doula can be helpful in that as well, of just like, hey, here are these basics that I can already do. Thinking about adding something else, but here's my budget, or here's the time that I have available. Like, what would be the most beneficial? And we can kind of help narrow those things down for you too.
Oh yeah. Yeah, that's such a good point. Just to like help parents dial in what they can access and what would be most helpful.
Mm-hmm.
I wanted to touch on, we talked about this, Paulina, a little bit before birth plans, but I wanted to dive in more to that because sometimes I've noticed people can really, to use kind of a, I don't know if it's a Buddhist word, but people can really attach to a birth plan. And sometimes there's unexpected changes. What advice do you have for people when creating like a flexible birth plan and for navigating those unexpected changes?
Okay. And I think one piece that's helpful to frame that, so we're starting to move toward the language of birth preferences rather than birth plan. And so with that, it's already kind of shifting like, okay, these are my preferences in this, but oftentimes our birth doesn't go according to plan. So it's like ideally, if I'm thinking about, I'm envisioning, I'm manifesting these things that I'm hoping to have in my birth, that's super important. And another piece is that education. So when you're creating your birth plan or birth preferences, you're doing research around how do I feel about these different interventions, and whether that's for myself or newborn care, or things that may come up. You're doing that research and figuring out how does that feel for me. And in doing that, when these different things pop up during the birth, you already have this idea about how you feel about it, and you have the knowledge and the resources to share with your care team about how you feel about those things and knowing your options. And in terms of navigating the unknown, again, doula can definitely be helpful with this, but it's creating time and learning how to effectively advocate for yourself, and also having providers that are skilled in informed consent. And that is going to go a long way when those unexpected things pop up.
Yeah, I think that's a really great point. I didn't know that we're moving away from that language, and I'm
Mm-hmm.
really, really happy we are.
Yeah.
And I will moving forward, try to incorporate that because I
Mm-hmm.
do think that's a really key point. And I think that it even goes into like other aspects of life, like we were talking about before, like your stress reduction protocol, it can be my stress reduction preference.
Yeah, totally.
More flexibility and spaciousness around it.
Yeah.
So, okay, so doulas also do a lot of postpartum work,
Mm-hmm.
which, from my perspective as a pediatrician, that's what I see most often in my practice and how helpful it can be.
Yeah.
What are some kind of key practices or resources that you recommend for postpartum care, bonding with baby? What kind of help can doulas give in that postpartum period?
Yeah. There's a couple things that come to mind. As a doula, again, there are folks that are either full spectrum doulas or postpartum doulas, and their specific role is to come in after baby is home and help to take care of like cleaning tasks or meal preparation, helping to watch baby while the birthing person can take a shower or take a quick power nap, or they can help with laundry and all these other pieces. Again, just another helping hand to come in and be like, look, you do whatever you need to do. I will help. Like, let's work together. And again, that can be a really important piece. Another big piece postpartum is, again, coming back to that community aspect of finding your people and just being able to be around others who are having that same shared lived experience and, you know, are also not sleeping, and that you can text at 3 in the morning, like, oh, are you up feeding baby too? Like, me too. And again, just having and finding your people that are in there with you. So I really like Postpartum Support International. They're a website that has free virtual support groups that run every single day for a variety of different topics postpartum. So sometimes they're pretty specialized. Facebook is another great place to find new parent groups, and whether there's walking groups or other things. Um, and then another piece is pelvic floor physical therapy. So that's a big, big, big thing postpartum that I try to share with all my clients. And I think after baby arrives, there's kind of this saying that's like, oh, everybody pees when they laugh a little bit. Or, oh, you run, like everybody pees a little bit during that after you have a baby. It's just what happens. And it's like, no, that doesn't have to happen. And I think postpartum, a lot of folks can struggle with that or struggle with pain during intimacy and things like that. And there are people that that's their specific job to help you have a healthier relationship with your pelvic floor through the rest of your life. So those are the
Oh
three.
yeah, that is so important. I hear that all usually at about the 6 week mark is when
Yes.
people are more comfortable telling me.
Mm-hmm.
And I think everyone sort of thinks they're alone, that they're the only one that ever needed pelvic floor. And I am
Right.
here to say I have not met anyone that did not benefit from pelvic floor. So
Mm-hmm. Mm-hmm.
have any worries about that, like definitely talk to your, OB and get a referral,
Yeah.
or let your pediatrician knows they can refer you,
Yeah.
all of those things. But
Yes. Everybody needs it.
yes, everyone needs it. We just have like a couple minutes left. Do you have any like super common misconceptions you want to clear up about doulas or even prenatal yoga at all?
But yes, common misconceptions. There are a couple things that come up. I think one is that doulas are really expensive. Doulas can mostly be met at every price point. So sometimes there are volunteer doulas, and some hospitals now are even starting their own volunteer programs. In some
Wow, that's
states,
awesome.
it's really cool. Yeah, in some states, Medicaid is starting to cover doula support. Some insurances are starting to do that. We're seeing different company benefits also sometimes covering doula support. And you can use your HSA and FSA funds also for doula support, or on your baby shower registry. Create a fund for that instead of a diaper tower. Like there's different things there and ways to fund that support. And again, there are some doulas who do sliding scale or offer payment plans, and really they're all at different price points. So it can be accessibly found, and everybody deserves that kind of support.
Oh, that's just like amazing to know. I'm not sure that I even really knew that.
Mm-hmm.
Such great resources for people.
Mm-hmm.
Okay, in the final few minutes, is there any one single piece of advice that you wish every expecting parent knew as they prepare for their journey?
Yes. There was a lot of things that came to mind for this, but I think the one most important thing was your choice in care provider. And this can make such a big difference in your pregnancy and birth experience. So, the easiest way that I can think about comparing it to is coming back into yoga, using a yoga analogy. But for folks that have done yoga before, you wouldn't necessarily go to, let's say, like a hot yoga vinyasa class, which is like very active, you're going to sweat, and be expecting a yin class, which is usually like you're laying the whole time. You have some blankets, you might fall asleep. And if you go to one of those classes expecting something else, you're not going to get that. And so, similar to that, some practices are really good at managing high risk pregnancies or managing surgical births. If you are hoping for a lower intervention physiological birth, but yet you're going to a practice that specializes in managing higher risk pregnancies, you're not going to get the experience that you're hoping for. And so, by asking whether it's doulas in town, midwives in town, even if you're not in care with them, like DM us, email us. We would love to share with you the care providers and practices in town that we see providing informed consent, that we see providers being really flexible, honoring those preferences, that believe in physiological birth and want to support and help you through that. Even if you're finding yourself in a higher risk scenario, again, those practices that are still wanting to work with you to honor those preferences and managing your high risk experience is going to go a long way in reducing the potential for birth trauma and, again, just the satisfaction of the birth experience overall. So please don't make that decision lightly of who you go for care.
Yeah, I mean, 100%. It's kind of like in my world, you may be going to like a very fast-paced pediatric practice that
Mm-hmm.
specializes in volume-based care, and that may not be the experience that you're looking for if you're looking for something more personal and tailored. So
Yeah.
completely agree. Definitely look for the people that align with your values and reach out to doulas that can help you decide. Paulina, where can people find you? How
Yeah.
can they reach you?
Totally. So my website is everybodydoula.com, and I'm also on Instagram as everybodydoula. I would love to hear from you via either of those platforms. And yeah, if you want to follow along, feel free to follow me on Instagram as well.
Okay, amazing. Thank you so much for being here today. I really appreciate it, and I'm wishing everybody well.
Yeah, thank you so much.